Hello, I'm Deborah Davidson, Director and Founder of Catalyst Conversations, and I'm happy to welcome you to a Catalyst Conversation. I want to thank the Broad for its continued enthusiasm for Catalyst, and Sharon Humphreys and Nora Long in particular for working together to make the program possible this afternoon. Catalyst Conversations was founded at the end of 2012 to open a critical path for dialogue between the arts and sciences. We present intimate and provocative conversations between artists, scientists, and the public. And we are interested in connecting the two through programs, educational outreach, and public events like this, which demonstrate the important conversation and synergy between art, science, and technology. In conjunction with the current exhibition, Remembering Together, Marking Life's COVID-19, founder and participating artist Liz Awalt, Broad infectious disease researcher Roby Bhattacharyya, and Broad visualization software engineer Benjamin Cooley are discussing how they each continue to deal with COVID-19 and the immense loss of lives in our nation and around the world. Their conversation is an opportunity for the three of them to share and reflect from both a scientific and artistic point of view. Underlying their respective practices is a spirit of generosity, a manifestation of our collective humanity, demonstrating how both contribute to that essential notion of who we are and the necessary optimism for the future. Liz Awalt says about her collective project, when the numbers of COVID-19 deaths skyrocketed in December 2020, I was struggling to justify my painting practice amid the raging virus, divisive politics, and racial injustice in our country. I decided to respond by acting on an idea that broke through my sense of despair. This idea was clear and simple. Make a painting with 1,000 separate marks, where each mark represents and honors a life lost to COVID-19. Roby Bhattacharyya Lab aspires to be a kind, collaborative, and inclusive environment in which to pursue rigorous science that addresses important questions in infectious diseases. We value diversity of thought, experience, and therefore identity, and we believe that this diversity enriches the science we do, the questions we choose to ask, and the people we become. Benjamin Cooley wrote early in the pandemic that data has been used as a means of warning, informing, and educating. To be sure, this is important work, but in reporting the pandemic data, we also need to reinforce the humanity of the data. These positive cases are entire lives uprooted with rapidly evolving aggregated data sets, such as case counts, deaths, hotspots, and hospitalizations. And it can be easy to forget these stories and focus instead on precision. We welcome your questions and comments during the Q&A period. You can use your Q&A button, and Shannon Humphreys will read them to our speakers. So on with the program. Roby will present first, then Liz, then Benjamin. So Roby, on to you.
Thanks so much. And thanks for the opportunity to reflect on a year like no other, year and a half like no other. I'm really looking forward to the conversation. So for me, for those who don't know me, I'm both an infectious disease physician at Mass General and a scientist at the Broad. And my reflection on this starts back in March of 2020, because I spend most of my time here at the Broad running a lab. I actually only spend 6 weeks a year these days on clinical service at MGH, but I happened to get assigned, and it really was a random assignment, April 1st through 14th, 2020, to be on ID consult service. That assignment happened the previous September, the way that it always does for the fiscal year to come, and didn't seem ominous at all at the time. But as February turned to March, it became very clear this would be a service block like nothing I'd ever done. And so it actually sort of crystallized with this podcast. And so I thought I'd reflect back on this. I don't know if folks listen to the daily, but I remember distinctly walking the dog 2 weeks before I went on service and hearing the experience of physicians in Lombardy, literally openly weeping as they described their hospital being overrun, running out of ventilators, overfilling their morgue, taking care of an endless stream of patients, some of whom were their colleagues. And I remember just not being sure that I could possibly do this. But 2 weeks later, I did. And it was unlike anything I've ever done before. I'll never forget it. Half of our 1,000-bed hospital had COVID, it was infected with this virus that had infected its first human just a few months earlier. Our intensive care capacity was completely overwhelmed. We had 50 more patients with COVID who needed ICU care than we normally have in all of our ICU beds combined. And so we had to create five new ICUs on the fly during the 2 weeks I was on service. Not just create, but create in staff. That has never happened once before that I've ever heard of. And it had to happen 5 times in 2 weeks. What struck me the most at the time was the fact that we limited all visitors and family, even family, for these patients who were sick, many of them dying alone with only iPads or the nurse's phone to connect with their families as they died. And I remember being completely overwhelmed, feeling uncertainty about everything. Progress was slow. People got sick fast, but nobody got better fast. And we just didn't know what to expect for the clinical course. So I read all that I could to just try to understand what to do for patients. But I remember feeling pretty helpless as a consultant. You know, the primary teams were doing a lot of good. As a consultant, I'd come by and try to give advice, and I had no advice to give for this at the time. But I sort of, juxtaposed to that, I had seen the birth of this amazing response at the Broad to do testing. And this was a time when our hospital was testing dozens of patients a day, and, a wonderful hospital, an amazing place to work, but that was our testing capacity. And the Broad was building up from thousands to tens of thousands. And it's hard to overstate how important this was for patient care. My lab was brand new at the time. There were only 2 members in it, and they were actually both helping out with this response. And I was happy and proud that they were doing this. Otherwise we weren't allowed to come in at all. So this was just one of the best things I've ever seen science do in real time. And in addition to transforming the care of patients, this also gave rise to some research that I became involved in. We recognized that there was this screening program that Massachusetts Department of Public Health had instituted at local, at basically every nursing facility in the state. We recognized that there were outbreaks happening, and so they tested everyone and thought to add a question about symptoms. And I had no part of doing the work at the time, but then Niall Lennon, Stacey Gabriel, and Eric Lander reached out to ask if I could help contextualize what they were finding, because what they found was that patients without symptoms and patients with symptoms were shedding essentially the same amount of virus. And this became a really important observation. I think from the start, one of the most challenging things about managing this for our society was asymptomatic spread. And here we found evidence of a mechanism by which this was happening, right? That symptoms were unrelated to a virus, which means if you were infected, you might not know it and still be shedding literally 1 billion viral particles per milliliter. And so again, I turned to reading, right? Trying to contextualize this. This seemed like a really important finding. We pre-printed it as fast as we could. And I was asked with just putting this in context of what was known. So just like I had to try to take the best care of patients I could, I started reading. I'm not a virologist, right? I study antibiotic resistance, but I started reading I kept reading all that I could about this virus. But in the meantime, through the summer and through the rest of the year, our lives slowly returned to normal. I didn't redirect my lab. We still work on antibiotic resistance. So this crew of us were doing our best to get back. As we're an experimental lab. We were on the leading edge of returning to doing experimental work. My family and I pressed on, and our kids were home from school all of last year. My wife and I took turns watching them while the other one would work. We'd have one of us would have the morning shift from 4 a.m. to 7. One of us would work from 7 p.m. to midnight, and just making it work as best we could. And this was a group I was happy to share these efforts with. And then this, right? So I'm sure everyone's seen this plot before. I remember where I was when I got a text alert on my phone, November 9th, 2020, reporting greater than 90% efficacy. This figure came out a few weeks later than that when Pfizer applied to the FDA for approval. This was, I cried, and I almost woke up my wife, but it was 6 a.m, so I let her sleep. I had the morning shift that day. But it was the first thing I said when she woke up. And again, I just sort of kept reading. And I had not been trained in science communication. Those of you watching might know that I've come to do a fair bit of it, not as much as some of my colleagues, but at least locally, I've taken that on. And part of it was just that I had read so much by this point, And I'm trained as a molecular biologist and as a physician. So I can read the sort of, I'm not a virologist, but I can kind of understand the studies. I'm not a translational researcher, but I'm certainly well trained to read translational research papers. And that felt like a good combination of skills. And then as a physician, although I'm not trained in science communication, like maybe the most important part of my job is breaking down complex medical issues, communicating them to a patient so they can make a decision about their health. And that felt like just what I needed to do here. And especially the vaccines really pushed me to do this more than I had before, because it felt like it would be hard to do anything in my scientific career that would be as impactful as just trying to explain to people what I understood about these vaccines and why I thought they were such an amazing thing at this particular time in history. And so I just took that on. All of this happening sort of through 2020, but this is the one graphic that I think better than anything else describes for me what the unrelenting nature of this pandemic. And you've probably seen it. This was on the New York Times cover page when the US approached its 500,000th death. Each dot is a human, is a person who died of COVID. I happened to be on service in April. I was doing a lot of sort of backup COVID advice pager duty, 8-hour shifts here and there through the rest of the year. But my next time on service wasn't until January 2020, which happened to be this very dark band. And so much had happened in that time. We knew a bit more about what to do. I was vaccinated by then, but none of the patients were yet. It wasn't available yet to patients. And by that point, the only cases that the ID consult service was being called for were the really sick ones. And so it turns out that every single patient I saw with COVID on that January shift died of what I knew was a vaccine preventable death at that point. Maybe not perfect, but 95%. And that was really hard. So the other reflection I wanted to make was that I've known you can't go through medical training without realizing that health is inherently political. But that has been reinforced in a more visceral way during this pandemic than ever before, whether it's vaccine inequity shown here, whether it's structural racism and social determinants of health that have affected, even in our country, who has been exposed to the virus disproportionately, who has died disproportionately. This has just been I don't know the solutions to these problems, but I know it's important to try to find them. And so I thought I'd close just, I was asked to talk about what we're doing now. And I'd say this whole pandemic has kind of felt like the kind of roller coaster that this case trend in the US has looked like to me. I've returned back to my lab works mostly on antibiotic resistance now, although I collaborate when I can to help people working on COVID related projects. I just sort of do what I can to help out. I've seen the birth of a new field, of a new disease, and how much we've learned about it in a year. And that's really inspiring. And in some ways, it's inspired me to press even harder to ask questions that will help the care of infected patients, even if it's not in COVID, in antibiotic resistance in the field I'm trained in. And I keep the science communication going when I have opportunities to. And above all, I guess this whole process has reminded me how humbling science is, especially when it's so important. So I think with that, I will stop. Thank you very much.
Roby, thank you so much. Liz will present next.
Thanks, Roby. That was really powerful, and I'm just sitting here with chills because telling that early part of the story, it just all comes back in a really intense way. I myself I'm an artist in my own practice. In the early stages of COVID, the big shift for me just personally was that, all my 3 adult children came home after we moved to a new home and downsized. So it was a little chaotic and they were very unhappy. But personally for me, I was struggling to find a way to make sense of being an artist at this time. I'm not, often as an artist, you can feel as though you don't really have much power to help people in a condition like this in particular. So I began to just essentially start in my own way some work. And this is one of the first pieces I did. I began this is not indicative of my work as an artist because I typically work with nature and the landscape, but I felt like I needed to create something that honored the lives that were being lost. And because again, those graphs, those New York Times, you know, articles and graphs that you woke up to every morning, all they did was make me confused, enraged, and feel horrible. So I thought, you know, this is the best I can do right now, is just do what I can do. So I set off to initially make 1,000 marks on a page, and simply really abstract marks, quietly in a quiet space. It was more like a meditation and honoring. And I did several of these, and then I began to think this is quite interesting. It's interesting as an artist, as a process, and it somehow was helpful to me. So I invited other people. This is a image that you see now, is an image of the exhibit as it stands right now at the Broad Institute. There are 131 artists that have images in and work in the show. And we, Deborah, along with me, have installed this work. Very, very challenging to take all of these different types of work and put them together to read, both visually in some kind of sensible way. But I think we were quite successful at that. And you can see in these examples the range. And but if I can just go back to the beginnings of this project, I was essentially started it on Instagram, and I asked artists from all over, all of my Instagram followers, to consider joining me in this process. And many, many people began to do so. And I had never done anything like this before in terms of a project. And people began to post work, and along with their work, they often posted words of gratitude, thanks. They might have said something about their own personal life, that they had lost an uncle or someone else in their life, or they had gotten sick. And so the work just kept coming in, and it was it developed in its own way, a community of artists to relate and connect with one another over this subject. And because we didn't have any other way to do that, we all typically work in our own studios, very independently. And so I think, you know, one thing led to another, and it became quite a helpful project for many involved. I'm just going to point out a few examples of some of the artists' works. And this one is very indicative, and I think goes back to that idea of graphing and numbers. This is a artist, Susan Lyman, and she works in wood typically. And again, she was making work that changed and shifted for her during this period. All these little marks are, again, marks relating to as metaphor for lives lost. This artist came, the beauty of social media is that you reach people you would never know and never be able to reach otherwise. So this artist, Gabriel Gomez, is from Brazil, and he posted this work. It is about 1,000 little skull prints on fabric. And this, obviously in Brazil, they were, you know, experiencing quite a tragedy. And so when each one of these presentations, when they came through Instagram, just, they would both break my heart, and they would make me feel terrific that this community was developing. The work here is by Donna Castleton, and I think I want to just, you know, I appreciated all the various points of view that the artists had. You know, my parameters were very simple. Thinking about how do you take on such a big thing? How do you take on such a massive tragedy? How do you express that as an artist? So in many ways, it had to be really, really go very, very simple. And I asked artists just to make 1,000 marks. It was up to them how they did it. It's up to them what materials they used. And I, as you can see throughout this brief presentation, all the artists took it and developed it in their own language. Lisa Barthelson here is again using the same parameters, but she is making a collage, and the collage is made from her monotypes, a printmaking process that she cut up into various size circles. Intensive, dedicated, time-based work that Lisa did here. And this last piece is by Antoinette Winters. And as you can see, Antoinette posted this probably last January or last February. And it seemed absurd that the numbers would go that high. They had not gone that high yet. And this seemed almost impossible that they would get that high. And then of course, they went far beyond that. That's what I have so far for the presentation, and I could say more, but I think now it would be should go to Benjamin. Thank you.
So thank you so much, Liz. So resonant and sort of echoing Roby's presentation. And so Ben?
So my name is Benjamin Cooley. I also respond to Ben. And a little bit about me. I'm a visualization software engineer. I've been at the Broad for just over a year now. And previously I worked as a data journalist. So naturally I'm very interested even today in the stories that we tell with data and about data. So within the Broad, I am part of a group called Pattern, and we are a group of designers and developers that specialize in data visualization. So we are doing this work with a range of different labs within the Broad and some outside of the Broad to translate a lot of the data and research that's happening into more visual forms. That takes a lot of different forms, and here's just a few examples of them. Typically, we do rely a lot on data visualization. We create a lot of interactive portals to explore the data behind these studies, but we do a lot of scientific communication as well. A little bit different than Roby, but typically on the visual side, right? Doing these illustrations to try to explain and open up these complex scientific concepts. So I want to talk about data visualization as remembering. I started thinking about this idea in my kind of personal practice a few years ago about using data visualization for a personal use more so than just a scientific and analytical use. So I did this little pet project in 2019 where I tracked all of my data, as a lot of us do now with Fitbit and Apple Watches and those types of things. And at the end of the year, I visualized this data, and I wanted to know what it said about me, what it said about my year, and all of these interesting things emerged that I forgot happened. Like this, huge blue circle here was the time that I decided to ride my bike to Walden Pond, or some of these yellow marks are when I went cross-country skiing for the first time. And so all of these things that I might not have reflected on, the process of actually changing these numbers from their data form to a visual form helped me to reflect on them. So fast forward a year, and during the kind of lockdown era of the pandemic, I did a lot more reading at home. So I took a similar approach. I tracked my books using the Goodreads app. And then at the end of the year, I sort of started to translate that into an interactive essay and data visualization piece where I could group the different books into their genres, into their ratings, And I could also go back through the reviews that I left and learn or relearn what I liked about them, what I didn't like about them, and reflect on that process. So the kind of era of COVID-19, I think of as a huge moment in data visualization for monitoring and learning. This was a time when some of the work that I do became part of the common way we communicate about it, right? As Roby was saying, these curve charts from the New York Times, these heat maps, this became almost a new visual language for how we think about this disease, how it spreads, who is at risk, and the people that we're losing as well. And around this time, I was really struggling personally to figure out what to do with all of this information. I think as so many people were. I knew that I had skills that were useful, and I felt that my work at the Broad was important. But personally, I was feeling a lot of number fatigue. And I didn't quite know how to comprehend the scope of this. And I started asking this question, is more data always better? And by asking that question, it led me to this interesting study from a researcher and psychologist named Paul Slovic from the University of Oregon. So this study wanted to know which factors influence charitable donations more. So what they did is they split participants into two different groups. One group was told a story of a single child in poverty that would benefit from these charitable donations. And another group was told the exact same story, but they were also shown statistics about millions of other children who are in a very similar situation of poverty that could benefit from these donations. And then they measured the donations that came in from each group. And what they found may feel counterintuitive at first. The story of the single child in poverty on average received about double the amount in charitable donations. So as soon as you introduced statistics into your pitch for charitable donations, you could actually expect a decrease of almost half of the amount of money. So one kind of very simple way to have a takeaway from this is that statistics often don't convince people, but stories do. And there's a lot of different directions you could take that, but it felt like an interesting thought as we go into the collective conversation. Two quotes really stood out to me when I was doing a lot of reading in this. As the numbers grow, we sort of lose the emotional connection to the people who are in need. And he also said that statistics are human beings with tears dried off, and that's dangerous because we need the tears to motivate us. So that leads me to data visualization as grief. And this is an idea that I ended up writing an article about and how I was clued into this panel and conversation. So again, looking at these charts, they're super informative, they're hugely beneficial and essential to this public health challenge. But I started wondering, what are we losing? What are we missing? Who are we leaving out? When we're looking at these charts. So I was trying to wrestle with how to process that personally. And so I created the following visualization. It's 300,000 lives lost, 1 mark for every life. And this visualization was created from data in December. And so obviously we are well over double the amount of lives lost now. But at the time, I really felt like it was important to pay tribute to each individual life, each individual dot. And of course, the New York Times reference is very applicable here. They took a very similar approach. But I wanted it to feel more like art than a data visualization, even though it technically is a data visualization. It's not as informative as you might see in a newspaper, but it was more about how it felt, I think, for me, and what that communicated as a way to focus on the story. So I'll leave off there, and I'm looking forward to the conversation.
To all of you who are, I'll just repeat it, you all practice, in your respective practices, there's a spirit of generosity, and where you've all, we're all suffering from what's going on. And, you know, you've all turned it around to kind of help all of us, I feel. So I'm going to start with a quote. This is just to get the conversation going. And, you know, the idea of metaphor was repeated a couple of times. So this is something that novelist and physicist Alan Lightman once said to me. He said that both art and science need metaphor to find something new. And at some point, science needs to go beyond the metaphor and art can stay within it. And it seems like that's just something to kind of, that's resonant for all of you. So here's a question, just throwing this out, just as a way of getting going. In both art and science, one works towards creating something that does not exist yet, something we want to see in the universe. For artists and scientists in all fields, that process of making something visible or understood is inherent. And so the question is, how do you experience that idea? So anyone who wants to start with that?
I mean, I guess I can lead off. It's a really interesting framing for the scientific process anyway. I can speak to. You know, one thing that I think I've learned actually as much from science communication in this pandemic as anything is to recognize uncertainty. And I think my first instinct, especially in communication, but also in science, is when I see something I'm not sure of, to maybe shy away from it, right? That's my instinct. I want to go to things I know. In medicine, we know we have to live with uncertainty and make decisions despite it. And in science, I think we're actually looking for things we can answer clearly. But more and more, I think this opened my eyes to the fact that if you want to answer the most important question, sometimes you have to lean into that uncertainty instead of away, and just do your best. At least that you have to balance these things. It's not all about finding the simply solvable problem, but it's about finding the important question and just doing what you can and getting help from others if you can't do everything you want.
Liz, do you want to add to that? Because it seems I sort of hear similar things happening in the artistic realm. Of course, the results are very different.
Yes. I mean, generally, personally, as an artist, you know, I have, and I often start with something that I see. You know, I'm visually inspired. It could be an artwork that I see. It could be, often for me, it's because my connection to nature is very important to my work. So in this case, though, it was very different because I don't work as an artist that takes a concept, an idea, and try to make it visual. And in this case, that needed to be done. And I was seeing a lot of, quote, COVID artwork. You know, there were some COVID art shows and things like that. And it seemed to, they often seemed to not hit the right tone for me. They were more illustrative of COVID and people and feelings. And so I think that, again, it was jumping into this project was really a risk. I'd never done anything like it. And I hadn't even worked this way exactly with this type of mark making process. So it just gradually moved. And I think essentially, once I started doing a few pieces myself and showing them to other people, and it grew as a bigger project, everybody came up with their own way of doing it. And what I might have thought of visualizing, I could never have imagined after seeing, you know, almost 200 other people contributing works and the way they put that together. So I think it's all an experiment, you know, whether artists are experimenting all the time. They're always like going into dark spaces and trying to figure it out. And responding to what they see around them and their own process.
Yeah, maybe I'll just add on to that briefly. something from the question that just stood out to me was the making something visible. That's something that science and art both tries to do through different mediums. And I think the work that I do is interesting because inherently it does combine both of those mediums a little bit. Like I do need to understand the data and the science, but then I also need to find a way to bring it into the new kind of visual realm. And I think personally throughout COVID, I felt, I was so impressed and by the innovation that was happening. We had these incredible pieces of data visualization, not just the charts, but there were these, simulations about here's how a mask is effective, and here's the particles that go through the air, and all of these things that were fantastic examples of scientific communication. But then at the same time, watching the numbers continue to rise and the deaths continue to rise, and really feeling, I guess, the limits of my own discipline, the limits of my own sort of ability to, well, if we can just make this concept clear enough, if we can just explain the science clearly enough. And I think that's a trap that is easy to fall into. But that's where like the real kind of complicated and messy side of art and of humanity comes in, I think too, where you need, galleries like Liz's gallery, where you walk in and you see all the different interpretations, because it's personal for people. And that's where you kind of reach the boundaries maybe of where science can take you, and you need art and other disciplines to maybe help bridge the gap that exists after you reach those limits.
Yeah, I think that's really well expressed. And, it's the scientists need the metaphor. I mean, scientists also need metaphor to kind of understand what they don't understand or what they can't see. And artists help, like, so let's just say the lay person in quotes understand something about it's something so enormous that you can't really think about it. That's kind of what I'm that's what happens to me personally. So and as as someone involved in the arts and with an interest in science, I keep this just kind of parenthetical, but in many of our Catalyst conversations, this comes up again and again, and I just think it's so important for people to understand that. And I just want to say again how much I appreciate everyone's honesty / generosity. I mean, I just think in a public forum like this, where you are talking, from your hearts about something that is so kind of profound and contributing to the understanding. So, yeah. See. Well, here's something. Actually, I'll just sort of relate it to previous Catalyst programs, which is, and we've collaborated with the Broad quite a bit, is that in most of our programs, these collaborative programs, there is the elemental need for optimism. It keeps repeating itself, and I just think this is more than ever we need this in this prolonged COVID moment. So for anyone to respond to that, that would be great. Maybe Roby, this would be good for you to start this.
I'm certainly happy to try. And the last slide I had with the undulating waves is kind of how my mood with COVID has gone at times. I think fundamentally I'm an optimistic person. And there are times when it's been hard to keep that. There certainly were times on service seeing patients not go, patient courses not go the way that I want. That was not easy to hold on to. I don't know. I mean, I guess I try to keep thinking about, I guess, what can be done to make things better, right? What's in the past, I think, can't be forgotten. And I completely agree with what both Liz and Ben have said, that data alone are not enough to convey. In fact, Ben's point, data may take away, like hard statistics may take away from what we've all experienced. I guess looking forward, I try to think about what can help. And I actually try to put my optimism aside. Like when I was trying to evaluate vaccine studies, I had to really, as a scientist, one aspires to not bring emotions into data analysis. At least that's certainly the teaching. And I really had to try hard not to have my hopes interfere with my scientific analysis of these studies as I was preparing for talks, and I have to try not to skew too optimistic. But I don't know. I think there are still reasons for optimism. I think in the tools that we've been able to build in a year and a half, that would have been unthinkable even a year and a half ago. I did not think we'd have vaccines like this in 9 months. I did not think we'd have repurposed treatments that would work as well as some of them look like they're going to. It's clearly not been enough to do what any of us would have wanted, but I don't know. I still think there are productive ways forward, and I hope that we can find them. And I have appreciated more and more that it's not just about the science, but about the society and how medical solutions find their way in a really complex world of politics and people. And again, I don't have those answers, but I guess those are my thoughts on the question.
Ben or Liz, do you want to add to that?
Sure, I can add to that. I do think that there's plenty of room for optimism, and specifically, I guess, as Roby kind of hinted at, the amount that we've learned, not just scientifically, but also just about our society, right? About people, about what people care about, and we are being forced to look at and rethink so many parts of who we are and who we are as a society and what we value. And so I think there's a real opportunity there, which presents for optimism. But I think, at least personally, it's important for me that that act of tribute and remembering has been really important to, because some people have stayed resilient through COVID, through that kind of stark optimism of like, oh, it's going to get better, and I'm keeping busy and I'm going for runs a lot, and that's all great. I think that it's also important to remember the loss and pay tribute to the grief, because that's what creates more, I think, sustainable change, right? It's not just, oh, we can forget about this and move on. And maybe sometimes I think with science is so forward thinking, right? It's so like, oh, we learned this about mRNA vaccines and we learned this about testing, and all of that will be so helpful for future viruses. But the arts, I think, can help with the remembering a little bit more too. And so they're in constant, I think, push and pull and working together.
Yeah, that's great. I totally concur with you that, it's sort of at the same time to hold and, honor grief, to be aware of all that. And that doesn't preclude optimism. In fact, it's sort of part of it. That's one way to go forward. So I'm just looking at the clock. Shannon is here with us, and she is going to read some of the questions in the chat and the Q&A. So, Shannon.
Hi. First, I wanted to thank all of you for your presentations. It's been a really amazing conversation so far. So from some of our audience, Virginia points out that uncertainty has been so much a part of our lives in the past year or two, and asks about leaning into the creative process. If you can comment on if on how you might have leaned into the uncertainty as a part of being creative.
Well, Shannon, can you just say that one more time? How did we? I just not sure quite what the.
How did you lean into uncertainty as a part of your process? Right.
I think it's in the nature of being an artist and working, is that often we we are very uncertain about our approach, but I think for me, leaning into how do I try to, again, visualize what I'm feeling and what I'm struggling with, and how do I do that in a way that I've never done that before? For me, and this goes back a little bit to the optimism question, seeing other people join in and contribute was huge. They were also doing it. They were also struggling. They were also trying to find their own way. And again, I think the sense of having a community of some kind. Certainly as scientists, you're often working with other people. Artists are often not. And so to have a community of people that are in tune and also being as honest as you, struggling with this thing and kind of knowing that you're working together on a bigger piece outside your own individual work. That really helped me, get through that uncertainty.
And I can add, or maybe even contrast, is that I think that I used the phrase, but I think the question was directed at the artistic process, but it's affected me a couple of ways, right? So leaning into uncertainty, how I've come to embrace that, like I think I mentioned in my opening, was it came actually through science communication, but it's affected the way I think about science. The first time it happened was when I was on some panels early on, right after I came off service. I was one on the early guard of people who had cared for COVID patients in the US and got asked to talk about it sometimes. And people were still asking about masks and are masks necessary? And I had just come off a hospital, time in the hospital where every single one of us was wearing masks at all times. I actually never took mine off. I didn't even eat or drink. I just didn't know what was going on. I lost 10 pounds in 2 weeks. It was crazy. But the answer at the time was we weren't sure we had enough supply to give masks to the public. And there was tension. I don't know if uncertainty is even the right word, but there was clearly a disconnect between what I knew was helping my colleagues and I, and what I sort of had this sense we were supposed to say. And I actually didn't get asked that question. And I remember thinking, boy, I'm glad I wasn't asked that question, but I also didn't speak up. I didn't say, that doesn't make a ton of sense. Masks help. We think they help us. They would help everyone. We may not have enough, but we should be honest about that. The second place, and I came to regret not speaking up. And the second place where I initially leaned away was kids and schools. And again, Brody's here will know I've had a few sessions on that, but I resisted that for a while because it just seemed too hot button and too personal and too uncertain. There's no right answer. Everything's bad. Going to school in a pandemic is bad. Not going to school is bad. Anyway, so I came to, again, just to say that, nobody has right answers here. I'm just going to try to learn everything I can. I ended up writing summarizing all the literature that was available with some colleagues at MGH and then talking about it. And almost every one of my answers was, I don't know, but here's how I'm thinking about it. And so I guess to then generalize to science, and I'm curious how this resonates with the artistic process, but it's scary to not know if what you're doing in science is going to be productive, because everything is on a timeline and one needs to demonstrate productivity at essentially every step in one's career. And yet, like I mentioned, I think the most important questions are the places where you're not sure if you're going in the right direction or not. And I came to appreciate that it's okay to flounder for a bit. And you need some regulation on that, and you can't flounder forever. But if you're floundering in important territory, then I think it's still a useful process. I've tried to embrace that more. And I think that came from kind of dealing with things in the pandemic.
Yeah, I can really resonate with that kind of that word floundering and feeling like I was in that place a few different times throughout the pandemic. And something that I tried to learn, I guess, in that uncertainty is to just give myself permission to be there for a minute. That it's not something that I need to power through, and it's not something that it needs to be conquered right away. But to have the humility of, these are the things that I don't know, and I might have ideas about them, but just to be honest externally, but actually internally, right? About like what don't I know? What don't I know about how I'm feeling, or this decision that I have to make about COVID. And to once I accepted that, I guess, and was realistic about this is where I'm at. Truthfully, I could actually reckon with how I was feeling and feel more confident about moving forward after I'd taken time to sit with that, I guess.
We have so many more questions in in the Q&A, and we only have a few minutes left. So I am just going to go to this one. Did you find yourself almost self-consciously refusing to sink into despair?
Oh.
No. I can easily jump into despair. It's not, it seems to be more my nature than being optimistic. And I still feel like I am in despair. I mean, it's not, this last year has been unbelievable in terms of all kinds of things. And, but, of course, as humans, we have to just keep plugging along, so it's a very difficult thing, but I think Ben said it very well, and he's really a very smart guy in just saying you sit with it. You can't throw it, you can't ignore it. The despair is there, and the more you can kind of feel it and get through it, understand it, it will help you get to then be able to act. That's the short of my answer.
I'll say I turned to family to avoid it and felt that I was lucky in a lot of ways. I can't imagine how different it would have been if I was living alone through this. And I know that that's a lot of people are. And I also was fortunate that I, didn't lose close relatives. My parents were, are in their 70s and 80s, and very high risk from this, but managed to sort of, hunker down. They didn't see their grandkids for over a year, but they stayed in their home until they got vaccinated, and they came to visit. And my being able to spend actually more time than, we're a 2 visit. My wife is also a physician. We would never have gotten to see our 1 and 4-year-olds grow into 3 and 6-year-olds up close the way that we did. And so, I took joy from that and felt okay. I didn't feel bad about feeling joy from that, even though there was so much despair around. I won't say that it was actually even that conscious. I didn't, do I self-consciously avoid despair? I don't think that I was introspective enough or had the time to be self-conscious about it, but that's what I turned to, was just that, like, I was trying to work in this crazy environment at home, but there were these amazing creatures running around that home and learning something and every day and surprising me. And, so I had to find joy, but I guess that was my process.
Wow. I think we're going to have to leave it there, right, Shannon? We're close to 2:00, and we do have amazing questions. I don't know, we could email each other, I guess, and continue this conversation. It seems like we could definitely do a part 2. I want to thank all of you for just the richness of the ideas shared, and your humility and graciousness, and just, we're all really grateful to all of you. So thank you so much. And thank you to our audience for your questions. And just to let you know, Catalyst, we're working on the spring, and this is recorded. So this will be on, can people find this conversation on YouTube, Shannon?
We will be posting it to our YouTube channel at the Broad within the next couple of days.
Yeah, great. Anyway, if you're not on our mailing list, you can go to our website at catalystconversations.org and join. And you can also see our many past programs and podcasts, which we were doing for a while. So Thank you again, and see you soon.